Hello everyone, welcome to our channel Common Nursing Guide. Today we will discuss about SBAR. SBAR is a communicating tool that is used by healthcare professionals. Like we can say it shift to shift report when the nurse changes his or shift and she handovers the reports. That is basically depends upon the SBAR. So firstly we will discuss about the definition. It is defined as a tool that facilitates communication between healthcare providers regarding the patient's health status. So let's start by its first letter S. In SBAR, S stands for situation. The nurse briefly describes the situation in this step by providing a brief summary. State nurse name, patient's name, ward or department, patient's condition. In this, the nurse explains about the patient's name, age, in which department patient is admitted, patient's condition, like the overall view of the situation. And in background, B stands for background. In this second step, the nurse explains about the background of the patient. Patient is admitted in the hospital with complaints of fever, headache, nausea, any chief complaint, or with specifically the admission diagnosis with which patient is admitted, and if the patient is undergo any surgery or not, if it is applicable, then we have to write the specific surgery or not, and the past medical history. Like in this background, the patient's medical background is explained in this, mainly with the admission diagnosis. So for A, assessment. In this step, the nurse describes the patient's current condition. Assessment, which the nurse is assessing at that moment, like vital signs, blood reports, head to toe examination. That depends on any visible changes like cyanosis or edema, maybe other kind of symptoms that is visible. So next is medication administration, like which kind of medication is administered to the patient according to the health status of the patient. Mainly the pain scale. Pain scale is used in this, like if the patient is suffering from pain, we have to measure it. Is it moderate, severe? So this includes in the assessment that the nurse is assessing at that moment. So next one is R. R means recommendation. In this step, the nurse follow up with the recommendation order. Like when the nurse is changing shift, so she have to hand over the nursing report to the other nurse that is joining the shift. So if the patient needs any dietary changes, any activity changes, any medication changes, so she have to mention briefly on that recommendation area. And discharge planning, anything about the patients that is recommended on the shift changes. Meanwhile, if this one is for the doctor, then if you are concerned about any health issues of the patient, so you have to write over here, like the patient is suffering from pain, and the Tylenol or the paracetamol, the drugs that are used for the pain relief, over the counter drugs that are not much effective. So you can mention the other drugs here and take permission from the doctor, so he can write the prescription according to the patient's health status. Like if these medications are not working, then you have to write on this recommendation area and suggest to the doctor. But you have to act only if the prescription is there. So I think all of you understand about this SBAR. S stands for situation, brief summary of the situation, B for background, any medical background of the patient, mainly with the admission, diagnosis, assessment. The nurse is assessing at the moment, so that includes in the assessment. And in the recommendation, you want to make to the nurse that is joining to the shift, like any dietary changes, any activity changes, any medication changes, or if you are writing this to the doctor, then you have to ask for the prescriptions if this drug is not working, like that. Hope all of you like this video. If you want another videos like this, interesting as well as knowledgeable, so you have to comment below the topics that you want to be discussed by me. Thank you.